What's up guys, I'm Zoe. I'm a foundation dentist working here in London, and this is Ali. He's a final year dental student at University of Newcastle.
In this video, we're going to be talking to you about our first patient experiences, followed by our top 5 tips on how to prepare for your first appointment.
So we'll actually start by talking about how our first patient appointments were. My one was, to be honest, quite boring. The patient didn't really speak much English, so I tried to get as much information out of them as I could, but I wasn't really able to build a good rapport with them or anything. I brought them in thinking they were my perio patient, but they ended up not having perio. Their BPs was just 1s and 2s, so I was a bit disappointed there. The only real highlight of that appointment was my friends didn't have a patient, so they were sat in their bay across, and when it got to the point of me asking a medical history, I asked the patient, "Are your bones healthy?" I didn't find it that funny at the time, to be honest, but they thought it was hilarious, and so they were just really laughing at me. But we've got some tips to help you guys with that as well. Other than that, my appointment was quite boring, to be honest.
I actually had a really interesting first appointment. 30-year-old male walks in, seems really normal. I remember calling you actually, so excited. I was like, this guy's got 2 cons, grade 4 BPEs, a partial denture, the works, everything. And I remember they kept grilling it into us, build rapport. And I remember spending, it was a 3-hour appointment. 2.5 of it was speaking about his family, his wife, his kids, everything. And half an hour was dentistry. I remember taking him down to radiology, and nowadays we'd never do this. It sounds silly to anyone who's a 5th year, for example, or graduated. And I went and sat for an hour with him, just speaking about I don't know what. After all of it, he didn't even come back. It was you'll go through this. And I know other friends that actually went through the same thing. It's quite frustrating sometimes. And that's pretty much how my first appointment went, really.
So let's actually start and get into our tips. So hopefully your patients will come back to you. Our first tip is patients have low expectations. Your patients know that they're being seen by students there, and they're not going to have really unrealistically high expectations of how the appointment will actually go. They know what they signed up for. So it's okay to actually make mistakes at first, or to stutter, or to get stuck on what you're actually meant to do. And keep in mind, the more patients you see, the more used to it you'll be, and you'll get a workflow for the way that you ask questions or the way that you do things. These patients won't really notice when you make a mistake because they don't know what the order is meant to be. So just try and keep a cool head, and every single time you think you've made a mistake or you're stuck on what to do, just ask your clinical supervisor for help, or even ask your nurse for help as well. And just keep in mind, patient probably has no idea how much you're struggling.
So moving on, our second tip is to be ahead of schedule. One of the biggest ways to reduce anxiety and be better prepared for your first appointment is by looking through your patient notes days before you see them. Hopefully they've been seen at the dental hospital before, and that will give you a better understanding of what you expect. Look at the medical history, see if this could affect your treatment plan, think about what your supervisor might want you to know and present that to them. I would familiarize myself with certain drugs, their indications, download the BNF app, I can't stress that enough. I would also look at the previous dental history to give me a better idea of what the status of their oral health is. Doing this will make it much easier to talk to the patient because you're not required to process as much new information on the day. Now that you've had a good idea of what you're probably going to be doing that day, I advise setting up your bay well before your patient gets in, and that way your appointment will run way more smoothly. Especially if you aren't familiar with where things are, it makes the process so much more sleek if you just don't disappear every 5 minutes to go get materials, equipment, whatever. The likelihood is that because you'll be seeing this patient for the first time, you'll need to do a history, an examination, and probably do some further investigations. The things I would have ready in the bay are all the necessary paperwork, the most recent radiographs, an exam kit, glasses, a bib, PPE stuff basically, a filled up water cup, and possibly an ultrasonic scaler if you get that far. Finally, iron your scrubs. If you look good and you feel good, the likelihood is that confidence will resonate to the patient and they'll feel so much more comfortable in your care.
So tip number 3 is practice taking a medical history. I know a lot of people struggle with taking a medical history, and that was me at first, but we're going to be releasing a whole video about taking a full history next week. But if I had to give one piece of advice, it would be to go to your clinic and take a medical history sheet with you, look at each category and come up with a sentence that you feel comfortable with asking. So for example, for me, for respiratory problems, I ask, do you have any problems with your breathing, like asthma? This is quite important for the more awkward questions, like instead of saying, do you have any urinary tract problems, I would say something along the lines of, do you have any problems going to the toilet? Instead of neurological problems, do you ever experience faints, fits, or funny turns? And another way to get some of these sentences is by shadowing or assisting others. And I know it sounds super nerdy, but if you ask some of the dentists at your hospital if you can shadow them, I think most of them will be up for it. And you can shadow them with a notebook, take notes on the sentences they use, the phrases that they use, and it can really help you. And to this day, I still use phrases that I've heard other people say, and it's really helped me a lot because I know I can be awkward sometimes, but with patients patients, it doesn't really show. Another thing you guys need to prepare yourselves for is surprising histories. Some patients are going to be very honest with you and they'll tell you confidential information, especially with their drug history. For example, I used to use crack cocaine or I smoke marijuana. And you need to learn not to react. If they mention something like that, just stay professional. Just note it, jot it down, and if you need to, ask further questions. So for example, if they say that they've smoked marijuana, you will actually need to know when was the last time they smoked, just because of consent issues. Too many times I've seen someone look really scared after they find something like that and they just jot it down and look really awkward, and it really does change the vibe of the appointment.
Okay guys, our fourth tip is to be organized, and this tip might feel really extra, but it was one of the best things I started doing in my clinical years. I used to go into clinics with my supervisors and they'd give me some amazing tips, and I would say to myself, 100%, don't worry, I got this, I'll remember this. Next day, I've forgotten it. You have to get a reflection diary and write down the main points of what you've learned, and also write down what went wrong in the appointment and how you would do it differently next time. I would split this diary up into the main subjects like restorative, peds, oral surgery, and so on. This helped me learn from my mistakes so much faster and meant that I didn't have to make the same mistake over and over again. Let's say my positioning was wrong while extracting a tooth, but I couldn't quite remember how it was wrong. I would open the book up, read in the oral surgery section, and fix up from my mistakes. You can even do this on the Notes app on your phone. It really doesn't matter how you do it, as long as you do. Also in line with this is to have an availability diary. Whether that's on your phone or a book, it really doesn't matter again.
So our fifth and final tip is to talk to others in your year. I found this really useful, especially when I was doing difficult things that I've never done before. So for example, if I was doing a root canal treatment for the first time, I would talk to someone who's just done that, and they could give me little tips like, for example, what materials to get ready before the patient comes in, or what things tend to run out at dispensary so I can get them before anyone else does. I mostly found it good to talk to my friends before these kind of appointments because it just made me feel more comfortable going into the appointment, because I just have a better idea of what I'm meant to do and what the supervisor expects of me. Alright guys, that was our last tip. Thank you guys so much for watching, and I hope it helped you. If it did, please drop a like and subscribe, and so the video gets out to more and more people. We'd love to hear what your first patient experiences were like as well, so just leave that in the comments and we can have a conversation about that. See you in the next video.
See ya.